Hi, it's Dr. Mark, and today I want to talk to you about Vertiball and your shoulder. The shoulder is one of those more commonly injured areas of the body, just because we use it so much throughout our lives. The shoulder is great because it has this mobility. We can move it in so many directions, where most joints you can move it front and back, maybe a little bit of side to side, but the shoulder goes everywhere. So the musculature that goes to support the shoulder can often become overused. So let me show you how you can use the Vertiball to help massage some of those areas, to use it maybe more in a myofascial type of capacity to get into those tender areas, and hopefully it can give you some relief. So let's get it set up and get right to work. We just want to take it apart. We're going to mount it onto the wall. Simply press it down. We're going to slide the ball back up into it, and we're ready to go. I typically say you want to get the ball a little bit lower than the shoulder, just a little bit. So my shoulder's here, it's maybe hitting the top of the unit, but we want to have it here because if we start up higher, we have nowhere higher to go. But if we start a little bit lower, we can typically squat down a little bit and hit different parts of the shoulder. So the two main areas that we want to use or to work with the Vertiball is on the back side of the shoulder, maybe some side, but also in the front. So when we're working on the back musculature, we want to create tension or a stretch, and we do that best by pulling the arm up across our chin or across our body. And then we're simply going to lean in, and we're going to want to work with the muscle fibers. So we want to go kind of side to side. If it's uncomfortable or if it's too tender in areas, just lean a little bit less. From there, we can go with the musculature that lines top to bottom. So for that, we can get our arm more upright like this. And if we're looking to get a little bit more of the side musculature, again, we can pull it across, but now we just lean a little bit more and work the ball down the shoulder. The last area we want to address is the pecs, so pec major and pec minor. Pec major is going to go from more midline out to the arm. Pec minor is going to go deep to that, and it's going to go about mid-rib out to the side. And for both of those, so if we're going to work on my left side, we want to pull the arm across as much as we can and kind of work side to side, massaging the Vertiball across pec minor, or pec major is going to be larger areas. And so we're just going to go, again, create as much tension with the arm coming across. We're going to work side to side, going into those tender areas. And hopefully that's going to help with pain relief and for range of motion. So I really recommend the Vertiball for a lot of my shoulder patients. It's so much better. It's a leap forward into what I used to say to use, which was a tennis ball or a baseball or lacrosse ball. The Vertiball takes it to the next level because it sticks out a little bit, it's secure onto the wall, and allows you to get into those really hard to reach areas of the shoulder. So give it a try and hopefully it helps.